Dr. Hector Perez, a leading board-certified bariatric surgeon in Cancun, Mexico, talks about his education and experience and the weight loss surgeries he performs. He touches upon revision surgery and explains the complete itinerary for overseas patients visiting Cancun for bariatric surgery.
Hello, my name is Hector Perez. I'm a bariatric surgeon. I currently work in Cancun and in Tijuana. I've been doing bariatric surgery for over 10 years by now. We've done over 1,000 surgeries with success, thankfully with close to zero rates of complications. Our expectations is to continue the same way. Well, I did my medical career in a private school in Mexico City called La Salle. After I finished my med school, I had to do something called internship. I went for that at the Jackson Memorial Hospital in Miami for a year over there. Then I came back to do my residency, my surgical training at the National Medical Center in Mexico City. I stayed there for 4 years, and afterwards I did a year of bariatric training in Mexico City also. And that's when I decided to come here to Cancun to start my private practice doing bariatric surgery. As I was telling you, I've been doing this for 10 years now, so we have by now a lot of experience. So many groups around the country invite us to show them how to do these surgeries. Unfortunately, in Mexico, there aren't as many bariatric surgeons as they are needed. So many general surgeons around the country are willing to start doing bariatric surgery, but they need training. In Mexico, we have currently probably 8 or 10 well-established one-year programs for bariatric surgery, but that's not enough for the requirements of obesity in Mexico. As you may know, the United States and Mexico are the most obese countries in the world, so we don't have enough surgeons to address that. So I constantly get invited to different small cities around the country to teach bariatrics. And also we are invited constantly to the 3 most important local or Mexican congresses to give the course of bariatric surgery that usually are 2-day courses where we give lectures, we do demonstration surgeries for many surgeons that come from other cities of Mexico to learn how it's done. Weight loss has a variety of procedures and a range of candidates, okay? Some procedures are not for the BMIs below 35, but we have other options for that, okay? We can divide bariatric procedures in 2 big scenarios. A restrictive procedure that includes the gastric balloon and the gastric sleeve. Back in the days, probably 5-7 years ago, we did another restrictive procedure called gastric lap band. Nowadays, that procedure is almost prescribed. There are still some places, especially in the United States, doing lap bands for low BMIs, between 30 and 35. But the problem is that it's shown that the patients regain weight, and also eventually after 5-10 years they need the band to get removed. So nowadays we mostly do gastric balloons for low BMIs or gastric sleeves as a restrictive procedure. What's a restrictive procedure? We're gonna make a patient eat less. And the gastric balloon, by placing a device, a balloon that maybe fill up to 600 cc's of liquid, and that will cover around 50% of your natural stomach, and you will be able to eat less. And with the gastric sleeve, what we do is we staple and cut between 75 and 80% of your stomach, okay? And while removing that part of the stomach, we also remove on the fundus of the stomach a hormone called ghrelin. The hormone ghrelin is the hormone of hunger. So patients can eat only 20 or 25% of what they usually could eat, but also are patients that they won't be hungry because we remove that hormone. And the other group of bariatric surgeries are the mixed procedures. Why are they called mixed? Because they have mild restriction, but they also have malabsorption. Those are the gastric bypasses. There are many variants of gastric bypasses, but they mostly work the same. We're gonna do a new pouch, a new stomach, that is gonna be between 15 and 20% of your natural stomach, but we're gonna bypass between 150 or even up to 3 meters of small bowel to attach it to your new pouch, so that now you're gonna eat less, but also what you eat won't be able to absorb in the whole small bowel. So you won't be able to absorb carbs and bad things for your weight. But we need to make sure that when we bypass the small bowels, you don't end up with vitamin deficiencies. Okay? And that's why they are different types of gastric bypasses. There's a gastric bypass called Roux-en-Y, that you bypass between 1 and 150 meters of small bowel, but you do another attachment below, like a Y, to make sure that all nutrients get absorbed. And another gastric bypass that nowadays is getting very trendy because it's having excellent results, especially in long-term weight loss and controlling diabetes and high blood pressure, is the mini gastric bypass, or also known as one anastomosis bypass. In that gastric bypass, what we do is create a new pouch, as I was telling you, but instead of bypassing 1.5 meters as our Roux-en-Y, we bypass 3 meters. Okay, so patients have less absorption, but we have to make sure that there are no vitamin deficiencies, and thankfully there aren't any. So we could tell those are the two big groups of bariatric surgery: the restrictive procedures and the malabsorptive procedures. Not all surgeries are 100% success or effective. The Roux-en-Y gastric bypass or the mini gastric bypass, that are considered the gold standards of bariatric surgery, has a success rate, long-term success rate of 88 to 90% of weight loss at 10 years. Okay. Unfortunately, there is a 10 to 20% of all bariatric surgeries that may regain weight. When you regain weight, we have to see what's going on, especially if you're not overeating, not following directions, and if those are being followed, what we need to do is to see if you're candidate to a new surgical procedure. Especially when you get a restricted procedure, you may think, if I get my sleep done again because my stomach stretched from a 20% to a 30%, maybe if I get rid of that 10 extra percent, I will lose weight again. That's a good idea, but in practice, it doesn't work that way. Why? Because when you lose 75 to 80% of your stomach on the first procedure, you end up losing a lot of weight, but also you change your metabolism. Your body learns how to function with less energy. So when we re-sleep patients, when we do a second sleep or a sleep on top of another sleep, what we've seen is that patients indeed lose weight, probably up to 20-25 pounds, but no more than that. So what we strongly recommend in patients that usually had a restricted procedure like a lap band or a gastric sleeve, if they regain weight, we should convert them to a gastric bypass, either or a Roux-en-Y or a mini gastric bypass. In our experience, we like to go to the mini gastric bypass because of one reason, and that's it. Because you can bypass more. You can go up to 3 meters for malabsorption, so patients that regain weight with a restricted procedure may go back to their ideal weight and stay there for longer. Cancun is paradise, okay, that's why we came to live here. But as a big city as it is, we have all the infrastructure needed for everything. Theaters, hotels, hospitals, schools, and we have very good hospitals in Cancun, okay? The hospital where I work, it's called Hospital Victoria, okay? It's a hospital that has everything, has a cardiac lab, has CT scan, MRI, ICU, everything, okay? And we have a state-of-the-art operating room with something called endosuite, that is the latest technology in laparoscopic surgery. So here in this hospital we can do all kinds of bariatric procedures safely. It's very important for patients coming this way to know that this hospital certified, that all my team and myself are board certified for bariatric surgery. What does this mean? It means that the hospital has been checked, the whole team has been checked on how we do the procedures in order to give safety to the patients, okay? Because as you know, this is major surgery and all major surgeries have risk. But being board certified means that you do these procedures in a safe way. Before you get to Cancun, you're gonna receive an email from the transportation service where they're going to explain you how they will pick you up at the airport, where to be at. Okay, they will take you to your hotel. The next morning they will bring you to your checkup at the hospital with myself and my team. They're gonna do all the pre-op work, an EKG, a chest X-ray, draw some blood. You will have internal medicine evaluation, nutritionist, psychiatrist, everything. Then as soon as we get the clearance of all of the evaluations for your surgery, we'll take you to the OR, do your bariatric surgery, and usually you stay for 2 nights at the hospital. After that, you get discharged 2 days after surgery, but before getting discharged, we do something called in bariatric surgery leaking test. What we're gonna do is we're gonna give you a blue dye, okay, that you have to drink. That we will check the drain for no leaks, but also we're gonna do an X-ray, okay, a live and dynamic X-ray where you will see your new stomach, how it works, how small it is, that everything passes through very well, and that indeed there are no leaks. After you get discharged, you have 2 options, because this is paradise. You can stay for a couple of days and enjoy Cancun, or we have a lot of patients that the same day that they get discharged, they fly back home to United States or Canada. The places where we get most of our patients are United States and Canada, but particularly in Cancun, we get a lot of Canadians coming from Saskatchewan, Calgary, Alberta, even Vancouver, and from the United States we get a lot of patients coming from South Carolina, North Carolina, New York, Washington, Florida, okay, this part of the coast. But we get patients from all over the United States and Canada, but mostly from those parts that I was telling you.
Got questions? We would love to hear from you in the comment section below. Tell us what else you want us to cover. And do not forget to share and like this video.